As an equine veterinarian, I find it very rewarding to care for senior horses, especially those that I have had the privilege to know and work with over many years. In my over 20 years here, I have quite a few patients now that I started caring for when they were 4 and 5 years old, and I've been able to continue that annual care, and they're now in their mid-20s to even 30s. In fact, this morning I did dentals on 2 horses that are 30 and 31 that have been longtime patients, and it's amazing to see what their mouths look like when we have been able to provide that consistent care. They still have all their teeth. They're able to stay on long stem hay and process that. We don't have to switch them to equine senior. A lifetime of care kind of encompasses the gamut of care, and it kind of depends on what age of horse you're talking about and what their discipline is. But it might be keeping their joints healthy for their entire life with some preventive care, with routine exams and flexions to make sure they're staying comfortable and able to do what we ask of them. It also encompasses pretty basic stuff like parasites and checking fecals and developing an appropriate parasite control program. It can also include things like blood work for some horses, monitoring Cushing's disease, adjusting medications as needed to keep their levels controlled and prevent some of the severe consequences like laminitis that can happen when they're not well managed. I find preventive care to be hugely beneficial if we catch the small problems while they're small. If, for example, we catch an inflamed joint while it is still just a small niggling problem for the horse and are able to quiet that down, it's going to prevent the onset of arthritis later on and potentially, extend their performance career, which can be amazing. So I find it really rewarding to manage horses into their older years as active performance horses by being proactive about taking care of those limbs and their feet early on. So clients often ask me at what age we should start routine dental care for horses. And what I typically recommend is that we start that when they're a little less than 2 years old before we ever put a bit in their mouth. And that way we can make sure that their mouth is comfortable, their first experience with the bit is a good one. And then we continue with that every 6 to 12 months as they age. Some horses need it a little bit more often, some a little bit less, depending on what their mouths look like. And if we're able to do that routine care just on a very regular basis for them, we can preserve those teeth into old age in a functional manner. Truly, one of the keys to great quality of life for a senior horse is consistent preventive care when they're young and continuing that every 6 to 12 months as needed.